Hello everyone, we're going to do a quick demonstration for you on how to do a maintenance infusion of amiodarone using the STAT2 extension set. The device comes packaged individually, includes an instruction sheet, and we're going to actually place this in between our IV extension set and our drip set. So as I'm assembling it, we'll kind of explain what the goal is here. I've assembled all my equipment. Again, an amiodarone infusion, we're going to want to deliver 1 milligram per minute, which would translate to 60 milligrams per hour. So this is for our ROSC patients. So we're going to assemble it as we would a normal IV set. We're using a 60 drop set, which is going to be actually really important because we're going to need to be able to use the drip chamber to confirm that our stat device is set to the right setting. And then that tells you that right in the manufacturer's instructions. So again, of course, we're always going to follow our aseptic technique. All right, so I have the iStat device, and I have my lock that's going to go towards the patient. So we'll remove the cap, attach it to the lock. Again, so this is going towards our patient. And we've got our wheel to set our drip rate. I'm going to attach it to our drip set. And we got to make sure we take off the cap. That would help. All right, so now our drip set is all set to go. Now we need to make our mix. I like to mix my maintenance infusions. I draw up 250 milligrams of amiodarone, and I put it into 250 mLs of saline, which gives us a very easy rate, or a mix ratio, of 1 milligram per ml, and it just makes the rest of my math very nice. Okay. So I like to use a 5 cc syringe when I'm drawing this up, because I know I'm drawing up exactly 5 cc's of my amio. So this is 150 milligrams in 3 mLs. So I'm going to draw 3 out of one vial and 2 out of the other for a total of 5. Alright, so that's 3 out of 1. Alright, so using the infusion port on our 250 bag. Now remember, with these short transfer needles, you really have to press very hard. Ideally, you'd want to use a longer transfer needle. Okay. So now I'm going to secure my sharp. So now I have 250 milligrams in 250 mLs. So if I connect that up to my drip set with my stat flow controller, I want to fill up my drip chamber right up to the line. Okay. We're going to bleed all our air out. Now make sure you have your stat flow set to full open, and obviously none of your clamps are set. So we're already going. So we'll slow down with the roller clamp here once we get all our air out. Alright, so we've got all our air out. So we'd hook up to our patient. Now, as far as actually setting this device, the numbers that are actually located on this wheel give you the number of mLs per hour you want to deliver. So again, with the way we've mixed our amio, it's going to be very simple. We want to give 1 milligram per minute, or 60 milligrams per hour. Because we've mixed it at a rate of 1 milligram per 1 ml, we're going to set our stat flow controller to 60. So we open the protective cover for the wheel, We line 60 up with our arrow. Lock it. Now the most important part, once we've hooked this up to this patient, is on our drip set, we want to make sure we open our thumb wheel all the way. Now even though we've opened this all the way, the stat flow device will only allow it to deliver at the set rate. So you can see a very slow drip coming out of the end. Okay. Now, again, per the manufacturer's instruction, while that's flowing, we're going to look at our drip chamber and we're going to count our drops. And we should have, at this drip rate, about 1 drop per second. And a last reminder, again, per the manufacturer's instructions, the infusion bag needs to be located at least half a meter above the infusion site. Ideally, the IV pole on the stretcher is probably not going to be our best choice for hanging the bag. It might not give us enough height. In order for the STAT2 device to work properly, it needs, again, that height of at least half a meter above the patient.